Good day, everyone, and welcome to the NHPCO's We Honor Veterans Partner Networking Call. During the presentation, all participants will be in a listen-only mode today. We will conduct a question-and-answer session after each speaker, and you will have the opportunity to share your stories at those times. If you have a question or comment at those times, please press star 1 on your telephone to enter the queue. As a reminder, this conference is being recorded, and I'd now like to turn the conference over to Catherine Kemp. Please go ahead.
Hi, thank you, Talari, and welcome everyone. Thank you for joining us. We're so glad you could be here. We're very excited about our call today. Got a lot of updates, a lot of news. Firstly, we want to just say hi and welcome to our recent community partners. On the call, we have Wesley Holloway from Cypress Point Health and Rehab in North Carolina. We also have Carrie Ann Coutu from Hanover Terrace Healthcare in New Hampshire. So just wanted to say welcome to the We Honor Veterans family. Again, we have kind of a packed schedule today. We're going to start off with some updates here from NHPCO. We have Amanda Bowe with our communications team, as well as Lauren Drew and Karen Davis from the Hospice Advocacy Network. Following that, we have Maura Flanders and Scott Bell from the VA Office of Survivors Assistance to give us some updates, go over a presentation, and answer any questions you may have. Joining us, as always, is Dr. Scott Shreve with some Department of VA updates, as well as answering any questions you may have. We also have Maura Johnson joining us from Storycorp Legacy. She's going to give an overview to partners about what Storycorps is up to and give you some tips on using their app, which I know some of you have already taken advantage of, but that will definitely be a big help. All right, so let's go ahead and get started. I'll hand it over to Amanda here.
Okay, thanks, Catherine, and welcome, everyone. Good afternoon or good morning. I just want to share some exciting opportunities that we have here at NHPCO and through the We Honor Veterans program for We Honor Veteran partners to share stories about the good work that you all are doing. So first off is our Creative Arts Contest, which NHPCO has launched in the last few weeks. We do it every year, and we look for partners, hospice providers, members to send in stories about impactful relationships within the hospice and palliative care community. And those submissions can come in the form of a photo, a blog, or a poem. And we're doing a little different this year. We're asking, We Honor Veterans partners to submit content as well. And this way you will actually get entered into the Creative Arts Contest, and you will also get entered into the second opportunity that we have, which is the We Honor Veterans Story Contest. So the deadline for the Creative Arts Contest is July 21st, and the deadline for the We Honor Veterans Story Contest is August 1st. So we really encourage you to submit your stories to the Creative Contest, and you'll be entered into the We Honor Veterans Story Contest as well. So 2 great opportunities for you to participate and share stories about your patients or about the work you're doing, about your team. And in the email that you'll receive after this call, the ladies will put some links in that will allow you to submit your stories online, and we really look forward to seeing those submissions. You guys all have great content to share. We share it on social media. We'll put it in our blog. So there's a lot of opportunity to get the stories out there and get them in front of the public. So we really hope you participate. And if you have any questions, you can always email me. My email address is real easy. It's abow@nhpco.org. We'd be happy to answer any of your questions about either contest. And please just send us your content. We love to see it, and we look forward to sharing it. Thanks.
Well, thanks, Amanda. And I also just want to remind partners that We Honor Veterans is on Twitter, @We Honor Veterans. So please, as Amanda said, send in your pictures, your stories. We love sharing them. NHPCO does as well, and it really sheds a light on the wonderful work that your organization's doing. So we love giving you all some credit. All right, well, now I want to hand it over to Lauren Drew with the Hospice Action Network. Lauren?
Hi, Catherine. Thanks. Hi, everybody out there. Good morning, good afternoon, good evening, wherever you are. I just wanted to hop on and talk to y'all real quick about a couple things. First of all, some of you are already aware we do a big summer advocacy intensive in Washington, D.C., where we train hospice advocates on how to talk to Congress, talk about policy, regulatory issues, problems you're facing at your programs, problems you're having serving the veterans at your programs, and take you up to Capitol Hill so you can get an audience with your member of Congress, have their attention, actually get to talk to them about some of these issues that impact your programs. We do have registration. It's still open, and we do have scholarships available for people coming from certain places. Cough, cough, Utah, New Mexico, anybody out there? Give me a call. We have scholarships available. We'll cover some of your hotel costs, possibly even your flights. Cough, cough, Alaska. I know it's a hike for you guys. But if there's anyone out there who's interested in attending the Advocacy Intensive, you can shoot me an email. It's ldrew@nhpco.org. You can also check us out online, hospiceactionnetwork.org. There's more information about the Advocacy Intensive and registration and scholarship information there. Now, I know for a lot of you coming up to D.C. for a couple days might be too heavy of a lift, and totally understandable. We'll also be running a virtual Hill Day during that time where we'll be having you email and call your members of Congress to talk about these issues as well. There's a lot of stuff going on in Capitol Hill right now if you've been paying attention, so it's kind of hard to get people's attention unless you really do show up at their door and blow up their computer and ring their phone off the hook, and then maybe they'll actually pay attention. So that's what we're trying to do. We'd appreciate your support as we try to do that. And also in the fall, this is a little bit more up your alley. We know Veterans Day is coming up. That's a big day, obviously, for the We Honor Veterans program. And part of what we like to do is involve members of Congress with the We Honor Veterans program. Veterans, as you know, face extraordinarily numbers of barriers and difficulties, not only in the healthcare realm, but through very other aspects of their lives, and making sure members of Congress get to meet veterans, get to understand some of the challenges they face, and get to understand that there are programs in their community that are trying to help, the more help we can provide to the veterans. So this Veterans Day, think about inviting a member of Congress to your pinning ceremony, your luncheon, whatever event you're planning on having. We can help you reach out and get the right member of Congress there or the right staffer so that they can really understand the kind of care and services you're providing. Again, you can email me. It's ldrew@nhpco.org. If you're not hosting any large events, we can help you arrange a small event as well. We've had members of Congress go on ride-alongs, visit hospice patients in their homes with the hospice patients' consent, obviously. We can help you arrange something big or small just to leverage the unique relationships and care you provide to the most benefit for the most people. So email me with any questions. We'd love to talk to you about any of that. Our website also has even more information about how you can get involved, bills in front of Congress right now that would benefit hospice and palliative care patients, and other ideas for just basically getting involved, participating in democracy for the benefit of hospice and palliative care. I'll kick it back to Catherine.
All right. Well, thanks, Lauren. All right, next up we have Maura Flanders and Scott Bell from the VA Office of Survivors Assistance. We're very grateful that they are joining us today. They're going to be giving us a presentation and then answering any questions that you have. They have also graciously sent on a PowerPoint presentation that highlights a lot of the topics that they'll be speaking on, so that will be included in our partner networking call notes as well as posted on our website under partner resources. Scott has also promised that they have, a ton of informational brochures, so feel free to reach out if you need anything in that realm as well. Okay, going to hand it over to Maura and Scott.
Thank you, Catherine. We're very, very happy to be invited to the NHPCO We Honor Veterans Networking Call. Not enough people know that we are here. I am a 32-year Navy veteran.
And I am a clinical social worker that's worked at VA for about 14 years.
And our number one job, really our only job, is to take care of survivors. And we define survivors as the parents, the spouses, the children, the brothers and sisters of veterans. And veterans are active duty service members, including Reserve and National Guard. They are people who stayed in long enough to retire, and they're people who did 1 or 2 tours to serve our nation and get out. There are about 330,000 employees in the VA, and there are a lot of people whose focus is on survivors' issues. But we've got 3 large administrations, the National Cemetery Administration, the Veterans Health Administration, and the Veterans Benefit Administration, and a group of very concerned and vocal survivors several years ago complained to Congress that there wasn't one office within the VA that they could go to answer questions that might go beyond just one administration. And they were pretty sick and tired of calling a 1-800 number and having to go through about 7 or 8 prompts to get to a computer-generated message that said, our answering machine is full. So Scott and I are here Monday through Friday. The best times are between 9 in the morning and 4 in the afternoon. And we also have a website. It's going to be on the information package that Catherine is going to post. And we've got a number. It's not a toll-free number. And if we're not in the office, we do have an answering machine, and we will call back. We really appreciate the opportunity to speak with you all today, because we appreciate how very, very much and how well you take care of veterans who are nearing their end of life. My own mother passed away recently, and she was in hospice care, and I can't say enough good things about hospice care to anyone, no matter who it is that you're taking care of. Recently, we found out that there was a bereavement survey that was being sent to family members of veterans who die in VA hospitals and who are utilizing hospice care that VA is partially funding or providing totally. And in the bereavement survey, there were a few questions at the end that asked if people felt that they had enough information about the benefits and services that were available to them near the end of their veteran's life and after. And the majority of people said no, that they were taken care of incredibly well throughout that very, very emotional and difficult period. But afterwards, they really didn't know what to do, and it was a time that they had to do so many things that they didn't focus on trying to find out. So we're thankful that the bereavement survey has added our phone number to it, and as I mentioned to Catherine and Dr. Shreve, just in the past 2 weeks, we have been overwhelmed with people calling and saying, I didn't know there was someone in the VA that I could call with questions. So we want to just describe some of the questions that we are getting from people so that you know what we can help them with.
Right, and thank you, Maura. I think it might be a good way or a good point to start here would be to give you a very short overview of some of the things that VA can offer to surviving family members, and then I'll mention some of the questions that we often come across. As many of you may know or may not know, the Department of Veterans Affairs offers a wide variety of benefits to surviving family members. Typically, these benefits are focused on surviving spouses and dependent children, but surviving parents sometimes also qualify. Our benefits mirror that which are offered to our veterans in that we have financial compensation, education benefits, health care benefits, the home loan guarantee program for certain survivors is available, and we have burial benefits as well. So there are quite a few different things that are out there, and one of the things that VA has known for years, and even now we're learning as well, is that it takes a little while for folks to apply for these benefits, and oftentimes that's because they just didn't know that they exist. So again, to echo what Myra said, and to extend our gratitude to Dr. Shreve, this recent partnership with VA's Hospice and Palliative Care has been very fruitful, and we're very hopeful that speaking with you all today will help as well. The type of questions that we receive often are, generally speaking, am I qualified for these benefits? But they can be as specific as, I qualified for I applied for a benefit, and it's been a reasonable amount of time in my opinion. Can you tell me what's going on? Or I have an issue that is dealing with the health administration. I wasn't satisfied with their care, and I don't think that they're sharing medical records with the benefits administration, so I'm not sure I'm receiving the benefits I deserve. And they can be complicated, they can be simple, but they are always important to the people who are asking, so we're very grateful for the opportunity to speak with them. So as we move forward here today, I'm very excited that you'll be sharing some of our information, and that we'll be able to share these packets that were mentioned by Catherine earlier.
And every single veteran has different circumstances, and some of their families who call, say, my neighbor next door or a friend of mine gets this, why don't I get that? And in general, as Scott mentioned, there are tremendous amounts of benefits, including bereavement counseling, that are available to everyone, and burial in a national cemetery for a veteran and for a veteran spouse, and also sometimes for their unburied and under age 18 children. But each circumstance is a little bit different. Depending on where some of you are calling from, there are very different costs of living. The VA has a wonderful program that helps veterans, now I'm talking about the veterans who are living still, who don't make enough money annually to have their income after they subtract medical expenses come up to $12,000. Now, I'm sitting here with Scott in Washington, D.C., and $12,000 annually wouldn't be enough to live in a tent. But there are some places around the country where that will provide someone enough money to have a good life. The VA provides, if there is a gap between $12,902, I think $12,907, and what a veteran makes, the VA will provide the difference between that spread out over a 12-month period. If the veteran has a spouse and dependents, that amount of money goes up. If the veteran is housebound, that amount goes up. If the veteran needs aid and attendance and has a spouse, that amount goes up almost to $25,500. When that veteran dies, their spouse is eligible for what we call a widow's pension, a survivor's pension. And that's something that's not really very understood around the country, but it is a benefit that almost 300,000 veterans are taking advantage of now, and almost 250,000 surviving spouses are taking advantage of. What we find is that so many times when someone calls and their veteran loved one has died, they aren't sure if their veteran is eligible to be buried in a veteran cemetery. So recently, just this past November, the VA came up with a form that we refer to as the pre-need eligibility for burial form that a veteran and a veteran spouse can fill out. Each one would have to fill it out separately. And those forms can be mailed into the VA. The VA sends out a letter that says, yes, you are eligible. And I think sometimes a surviving family finds that information to be very helpful, that they know their veteran can be buried at a veteran cemetery. When Scott and I do outreach around the country, we try to speak to veterans and ask them to please talk to their families about where they want to be buried and do they want to go to a veteran cemetery. And I'm not sure if you all are finding the same thing in hospice, if families are reluctant to talk about after-death programs. Depending on why or how a veteran has died, if their death is a result of a service-related injury or illness, or if they were disabled at the 100% disability, VA disability rating for a time before they died, their spouse and possibly their children are eligible for something called the dependency and indemnity compensation. We refer to it as DIC. And DIC is a tax-free payment, as is the widow's pension and the war pension for the veterans. The DIC payment goes up each year a little bit with cost of living. This year it's about $1,260. And we have people calling 7 years after their veteran died who are eligible for DIC and could have used that amount of money. And so if nothing else, if we could really ask you to please talk to veterans and to their families about understanding why their veteran is sick, how sick they are they receiving benefits from the VA, and do they know that after the veteran passes that we can help them with many things, including potentially a tremendous amount of money.
So I realize that we've been throwing a lot of information at you, and I think if there's a takeaway from this conversation today is that we're here, and we are more than happy to discuss these issues in depth, individually with your individual clients or at large with larger groups such as this, to talk about what can be available. And like Moira said in the beginning of her points, you know, each family, each veteran, each survivor, their circumstances are different. And there may be extenuating circumstances that makes one individual eligible for a benefit and might disqualify a different individual for a benefit. So the takeaway here being is that we are here, we are very eager to assist you, and that you have a friend at VA who has some background information to share. So I think at this point, did we want to open it up to any questions, or was there anything else that you wanted to talk about?
Well, I just want to, I'm sorry to throw out numbers, I just want to say that as of the most recent count, we've got 21,386 veterans living in the United States, and almost 700,000 of them are World War II veterans, and almost 400 World War II veterans are dying every day. And we've all seen the suicide statistics that active duty and veterans together, about 20 are killing themselves every day. So we know with fairly good accuracy how many veterans there are, but we don't know how many surviving family members there are. And we can't reach out to them because we don't know where they are, because veterans don't have to tell us how many family members they have and what their addresses are. So we're going to count on you to help us connect with many, many more who are deserving of the benefits that their veteran, their deceased veteran, worked and served his or her nation for. And with that, we are very willing to answer any questions.
Thank you. If you'd like to ask a question via the phone at this time, please signal us by pressing *1 on your telephone keypad. If you are using a speakerphone, please make sure your mute function is turned off to allow your signal to reach us. Once again, that's *1 to ask a question. And we'll move and take our first question from Patty Cooper with Emeritus Hospice. Hi, Ms. Cooper. Your line is open.
Hi, I'm sorry. I don't have a question at this time. I may have pressed something incorrectly. I'm sorry.
No problem. We'll move next to Kelly Miller with the Blue Ridge Hospice.
Hi. Thank you for all the great information. This has been a real eye-opener for me. I have a general question. I don't think it will really apply to hospice per se very often, but I could see where it might happen at times. You mentioned the benefit being related directly to a service-related injury or disease. And then you talked a little bit about the suicide rate, which I know is really way higher than it should be. But I was wondering, will this benefit apply if the veteran commits suicide and they have a history of PTSD?
That is a great question. Thank you very much. Here's a horrible statistic. 883,631 veterans right now are being treated by the VA and compensated by the VA for PTSD. And it does take a brave person to say they need help. So there are probably quite a few more out there who are suffering from PTSD. If a veteran is perhaps has been separated from the service and is being treated or compensated by the VA for PTSD, that means there is documentation that they are at risk. And it is very, very likely that if they kill themselves, that will be considered a service-related injury or illness. If it's not documented, there are a group of veterans, and there was just a press release yesterday by Secretary of the VA, Dr. Schulte. There are quite a few. I should have said this much earlier. Most benefits are available to veterans if they received something higher than and other than honorable discharge, because there are things called dishonorable discharge. However, recently, the United States Department of Defense and health practitioners have determined that there have been some men and women discharged from the military with dishonorable discharges who were suffering from PTSD, and their behavior reflected that, and they were put out not because they had PTSD, but because of behavior issues. As of yesterday, anyone who has been discharged from the military, even with dishonorable discharge paperwork, who is in an emergency situation, can go to any VA hospital or clinic and ask for help, and they will not be turned away. So I'm drifting a little bit from your question, but your question about PTSD is yes. The answer is yes, they will be considered service-related. And if someone who is a veteran kills themselves and there's no documentation that they were receiving treatment, it is still possible for the surviving family, the spouse and children, to receive compensation. It's going to take a little bit more work because they're going to have to get letters from other people, perhaps neighbors, friends, clergy, or doctors not associated with the VA who say, yes, this person was acting exactly like you would expect someone with PTSD to act. So a little bit away from your hospice area of operations, but an extremely good question. Thank you for asking that.
Oh, you're very welcome. We have had incidences where we have patients who have a documented history of PTSD, but they have expressed some suicidal ideation. Of course, we approach that in the way necessary to keep them safe. But should that ever occur, should they ever decide to do that, it's really nice to know that that this is available. Thank you so much.
Yes, ma'am.
And if I could just add to that 2 points. The second point being that, as many of you may know, the Department of Veterans Affairs also offers life insurance benefits, and sometimes veterans do enroll in Veterans Group Life Insurance. And deaths by suicide also still receive payment through the group life insurance benefit. That will not be a hindrance to the dispersion of those payments. The other thing I wanted to mention is only tangentially related, and that is to receive a survivor benefit from the VA, the veteran need never have established a relationship with the Department of Veterans Affairs as far as a healthcare consumer or a beneficiary of benefits. That surviving spouse that is left behind could still be eligible for benefits then. Just what would happen, and Moira touched on this, is if an individual does not have that groundwork of paperwork already established with VA, that onus would just happen to shift to that family member, but it's still possible to establish a service-connected relationship between an injury or an illness and the eventual cause of that individual's death with their military service, and that just would be the burden of the family member, but it can be done.
Just a reminder to our phone audience, it is *1 if you have a question or comment. If you find that your question has been answered, you may remove yourself from the queue by pressing the star key followed by the digit 2. And we'll move next and take Elizabeth Lee with Oxford Healthcare and Hospice.
Thank you. How do we reach the Office of Survivor Assistance from your group here? How do we get help?
I'm going to give you the telephone number right now. And for those of you who are going to read what Catherine posts for the after-call notes, it will also be on the last page of our PowerPoint slide presentation. The number is area code 202-461-1077.
We also have an email address that's available, and that email address is Office of Survivors, and that's all one word, Office of Survivors @va.gov. We have a website as well, which may be reached at www.va.gov/survivors.
Thank you so much.
You're quite welcome.
Next we have Pam Chamberlain with the Good Shepherd Hospice.
Yeah, and I just wondered if you could repeat your, I know you said numbers, the statistics on the veterans. I was trying to catch, you said there were 400 World War II veterans every day that were dying?
Yes,
but
because they're aging out, most of them.
Uh-huh. And then there was the 21,386,000, and I'm not sure what that number was.
Yes, that's the number of veterans alive today.
And did you say the majority is of, I thought you said World War II, but...
No, World War II vets are 696,000.
Okay.
But the majority of the 21 million are not connected with the VA. They have never registered with the VA. They are not receiving VA health care, and they are not receiving VA compensation. That doesn't mean they aren't eligible for it. It just means that they haven't established a relationship yet for whatever reason. And some of it is they just don't realize what's available to them. Some people think you had to have stayed through retirement. Or some people think it's only if you served during wartime. But the VA has benefits for every single person who served in the military, active duty, reserve, and National Guard.
Okay, thank you.
You're welcome.
And we'll move next to Kari Goldstein with Caring Hospice Services.
Hi, thanks so much. This is some great information, and again, thinking with hospice and how we so often receive referrals so late in the game, and we don't often have our patients, and especially our veterans patients, with us for very long. I think one of the wonderful things that we're hoping for as we move on with the We Honor Veterans Partnership and the NHPCO is trying to streamline and in some way be able to speed up some of these things, because as we well know with all governmental assistance, things can be very lengthy in the application process and then actually, getting these services to fruition. So any advice there, or, are you guys the right ones to call as soon as we identify that we do have a veteran and that they and their family could benefit from these services?
Yes, a veteran does not have to have passed away before their family member contacts us. That's what our office is geared toward, but we answer many other types of questions. There have been stories for years about the backlog of VA claims and waiting lists at hospitals. I can tell you, in terms of survivors, the process for getting compensation to them, I think, is very, very fast. There are what we call regional offices around the country, pension management centers around the country. Some states have quite a few, and I believe every state has at least one, as do some of the territories. When it comes to survivors' issues, there are 3 offices in the United States that deal with their compensation issues, and those 3 offices take care of the United States, broken into 3 pieces. It's Philadelphia for the East Coast, and then St. Paul, Minneapolis for the Midwest or the middle of the United States, and then for the West Coast it's Milwaukee. So survivor compensation requests in terms of the actual paperwork, the forms, the death certificates, all of that being sent in are turned around usually within 60 days. Also, the National Cemetery Administration does, I think, a absolutely fabulous job turning around the request to be reimbursed for some of the burial expenses. The VA, of course, provides space at veteran cemeteries, and that includes the grave site, the headstone, the opening of the grave, the closing of the grave, or a niche in a columbarium if someone wants their remains to be cremated and put in a columbarium. But there are also many other costs associated with that time in someone's life and death. And so the VA does pay for some of the expenses that the family pays for, and they turn those around usually within 3 days of receiving the form, the receipts, the death certificate, and the DD-214.
One thing to consider for the timeliness of a claim is that the Benefits Administration really, it's a partnership, and the more complete and accurate an application for benefits is, the faster they can turn it around. And so if an individual sends in an incomplete claim, that's just going to add a little bit more time to the process. And ideally, we still get to the same place, and they will still receive back pay at the same date. It just prolongs the process, though, and that can be unfortunate, especially when people are facing financial hardship. And there are mechanisms in place to expedite claims. For example, if a potential beneficiary is infirm themselves, they're ill, they're approaching the end of their own lives, or if they are facing financial hardship, as I mentioned, for example, they might lose their home, or they're going to have their power turned off, or what have you. There are mechanisms within the Benefits Administration to prioritize those claims. And if you have somebody in that type of scenario, please bring them to our attention as soon as you can, either ourselves or the Benefits Administration, but preferably us. And we would, mainly because we work very closely with the Undersecretary of Benefits Office, and they have a wonderful work group that can really speed things along. And we've been very fortunate to have a wonderful partnership with them. So if you get them in front of us, we'll get them in front of them and help move those things along.
Wonderful. Thank you, guys.
Thank you.
Once again, just to remind our audience, star 1 if you have a question or comment. We'll move next to Rana Coplin with Hospice of Helping Hands.
Hi. Just wanted to share a personal story about survivorship. In March, my brother-in-law died unexpectedly at a VA contracted facility, and because of our We Honor Veterans activities at the hospice that I work for, I knew right to go to our Veterans Alliance officer with my sister with his DD-214, with his death certificate, and it was such a learning experience because I've been in hospice for 16 years, part of the We Honor Veterans since it started in 2010, and did not realize all the survivor benefits that my sister was, eligible for. And in turn, I have a brother that's 100% service-connected, 2 tours of Vietnam, and didn't realize, like, his wife's Social Security number should be on part of the veterans. So it was a wonderful experience dealing with the survivor benefits and the department and things like that. But just for people to know that are part of the We Honor Veterans, you need to support your Veterans Alliance officers because they were a great resource. We're in northern Michigan, and the nearest VA hospital was an hour and a half away, is where my brother-in-law died. But it was a positive experience as far as getting the survivor benefits, and just wanted to thank you guys for helping and looking for more education, I guess, for our patients, survivors. So,
well, thank you for that comment. We are very lucky. We work directly for Secretary Schulte, and sometimes when he testifies in front of Congress or at town halls, he gets a lot of negative comments. And we sit here and we say, but if he talked about all the good things that VA does for survivors in a very, very difficult time of their life, I think people would be much happier with the VA and the taxpayers' money that goes toward the VA. You mentioned the DD-214. That is such an important document, and so many family members who call here when we say, in order to fill in the form and have it processed quickly, you'll need a copy of the DD-214, and the next response is, what is that? Mm-hmm. So as you all are talking to family members and veterans in their last days and weeks, if you could mention the DD-214 and how important that's going to be in the next few days and weeks for all of them. That would be so helpful for them.
And we'll move on and move next to Denise Welch with Seasons Hospice.
Hi, thank you very much. Boy, this is just a lot of great information. We had a veteran on our hospice who definitely was suffering from PTSD. I don't know if it was ever documented with the VA. I kind of think it was. And his sister took care of him. So I don't know if she would be eligible for any benefits from having cared for him. So would this phone number that was provided, the 202-461-1077, be a good place for her to call and start?
Yes, it would be a great number for her to use to start. And then we'll have to find out the specific circumstances.
Right, because if his benefits were helping to support her and her family, could she possibly be eligible?
Regrettably, Congress, the way that the survivor benefits that have been already put out, the way that they're written, they are not extended to surviving siblings as far as financial benefits are concerned. She probably, if her brother was suffering from post-traumatic stress disorder, she probably would be eligible for bereavement counseling at one of our veteran centers. But as far as a financial compensation, I'm afraid that's probably not going to be available to her.
Okay, well, that's good to know. And what did the DIC stand for?
Dependency and Indemnity Compensation. Dependency and Indemnity Compensation.
Okay, and Mara, can you spell your name for me, please?
Yes, it's M as in Mary, O-I-R-A. Last name is Flanders, like Flanders Field, and then it's Scott Bell, Scott with two T's. And in the PowerPoint presentation that Catherine's going to post, our names are on there also.
Okay, great. Thank you so much, both of you, for all of it.
You're welcome. And you mentioned caregiving. Depending on the era that the veteran served in, whether it's post 9/11, pre 9/11, and depending on their level of disability, their caregivers, who are probably their family members, may be eligible for a stipend from the VA. So again, anyone with any questions, please call us, because if someone is another person's caregiver they usually are not working in another job, and finances can become very difficult.
Right. So would she be eligible for a stipend after the fact?
After the fact, not, unfortunately.
Okay. Okay, yeah, because he served 3 tours in Vietnam to prevent his brothers from going.
Mm-hmm.
It was just really touching. So, and anyway, thank you.
Yes, ma'am.
Next, we'll take Toby Weiss with MJHS Hospice.
Hi, how are you?
Hello, how are you?
Hi, I'm good. So much important information. I'm so glad I'm on the call. I have 2 questions. One is, as far as the discharge papers, I know that in the present time, veterans can access those discharge papers online if they don't have them. My question is, how far back, if somebody's military service was World War II, Korea, Vietnam, can they also access it online or not?
When you're mentioning accessing online, are you speaking of requesting service records or actually viewing the service record online?
No, receiving it. They need it. If they don't have it, they lost it.
Absolutely.
For whatever reason they don't have it. We need that in order to make sure they're service connected.
Sure.
So
any period of service is available from the National Personnel Records Center, which is managed by the National Archives. And so an individual, if they have internet access, can go to www.archives.gov, and right on that main page of archives.gov is that famous and beautiful photograph of the Marines on Iwo Jima raising the flag. And you just click on that, and that will take you to requesting military service records. And they do several things there, actually. So you can request military service records. They also have services where they can reissue past commendations and awards. So if you need another copy of a medal for maybe a shadow box or something like that, they can help people with that. And one other thing, though, to consider is that, was it 73 or 74, where the fire? There was a huge fire at the National Personnel Records Center in St. Louis in the early to mid-1970s. And a great many records were lost or destroyed. It was in 1973. And those, the branches that were impacted the most were Army records for services between, I'm reading off their website right now, between November 1st, 1912 through January 1st, 1960, where they lost an estimate of 80% of those records in this fire. And as well as Air Force records from September 25th, 47 to January 1, 64, they lost 75% of those records. Now, that is not to say that those records are, gone for good. They do have auxiliary records available. They have teams of specialists that will help reconstruct DD-214s and what have you. But they would, a family or a veteran would simply need to contact the archives in order to do that. But to your question, they have records dating back probably Civil War and before. So those service records are on file and they should be available.
And they're available to request via online. You can fax and you can call. And if it's an emergency, say someone has passed away and the funeral home needs to have the DD-214, they will accommodate people and turn things around overnight.
Oh, that's amazing. Okay, that's a very, very, very important point, because on hospice it's not always easy to get the information when you need it because of family dynamics.
All you have to do is call them and tell them how important it is. I think some people are hesitant to say it's urgent, but certainly in hospice it's urgent.
And if it's not urgent, they could expedite it. If it's not urgent, how long would it typically take?
It really depends. I've heard it as little as 2 weeks. I've heard it taking a couple months. I think it depends if there are any damaged records involved, or if it's all digitally available, or if they have to actually look at paper.
All right, so it's significant. It's of significant importance for us in the hospice field to access that information from the patient and the family as early as possible on program, so that if need be, we take measures to get the information for them.
Absolutely, and the surviving family is going to need that DD-214 for so many things. The sooner that you can ask them if they have a copy, the better it will be for them.
So I have one other question, which is probably yes or no. We, in our hospice, for somebody who's on routine home hospice, we will give them as part of their benefit 15 hours a week of home health aid. I know that we've tried in the past to help service-connected veterans who are getting help from the VA to get additional hours. And my understanding, unless I'm wrong, is that the maximum that they could get is 26. If that number is correct or slightly off, my question is there any talk in the VA about changing that number for the frail elderly or the terminally ill veterans who really need additional care that would otherwise not be able to pay for it?
That might be a question that Dr. Shreve, if he is still on the line, could answer better.
Yeah. I'm still on the line, but could you summarize the question again? I want to make sure I heard it correctly.
So typically a hospice patient, somebody who's on a community hospice, along with the comprehensive basket of services that are Medicare covered and reimbursed, is a certain number of hours of home health aid, certified home health aid, and different hospices will offer different amounts. We, for example, on the routine home hospice benefit, will give a patient 15 hours a week, 3 hours a day, 5 days a week, or however they want to use it. And when there's a veteran who is service-connected, they may be getting some home hours from the VA from their benefit. But my understanding, when we've tried to advocate for helping them access additional hours, that there's a cap on the number of hours that the VA will pay for, which is 26. So it's not like they're going to get whatever the VA gives on top of hours. There's a cap. My question is, for veterans who are terminally ill and really need additional home attendant help, is there any talk about increasing the number of hours that the VA would put in?
Yeah, this is a complicated question. I'm going to try to answer you directly as best as I understand it right now. And Catherine or others, I welcome you correcting me. My understanding is that the conditions of participation require community hospices under the Medicare hospice benefit to provide all of the care that is needed. And so, even your perhaps arbitrary cap of 15 hours per week varies from hospice to hospice, but that any care needed as a result of the terminal illness is to be provided by the community hospice program. Having said that, where I have heard of challenges is when there's a highly service-connected veteran who is getting a very significant amount of hours, that I have heard of the VA saying, the veteran's now hospice, and I'm being very honest here, the reports have been that the VA, some VAs have said, well, the hospice now has to provide all of the homemaker home health aid hours, and that hasn't seemed right to me, that they may not all be related to the terminal illness. There may be a conglomeration, if you will, of illnesses that lead to the need for this care. And then my last point is I have never heard of a cap of 26 hours per week. and that I would need to look into. I've asked the homemaker home health aide leadership in VA, and that's never been shared with me. So my bottom line, I think, is that one, community hospices should not expect the VA to cover all of the homemaker home health aide hours just because this is a veteran and they're enrolled. But I do think there needs to be increased collaboration that we can optimize those hours in collaboration with perhaps some provided by the community hospice in support of the terminal illness, and the VA may need to contribute some of these homemaker home health aide hours for illnesses or functional deficits not necessarily related to the terminal illness. But does that sound reasonable? And two, I don't believe I'm going to get back to this call with a specific number that says VA must provide X number of hours. I almost think it's on a case-by-case basis.
What you're saying sounds reasonable, although the premise that community hospices have to pay for all of the home aid hours relevant to the patient's terminal illness is not accurate. The community hospices have to put in home health aid hours as the need requires for supervised plan of care, but not for custodial care of the patient. And when the patient on a community hospice has a crisis or a higher acuity level of care need, in those circumstances, until that elevated level of care need is stabilized and managed, then they can put in continuous care or crisis care, which is round the clock. But once a person is back to that routine home hospice benefit, it reverts back to a more limited number of home attendant hours. That's how it typically works.
Yeah, I'm not, and it sounds like it's variable at community hospices, and I'm not familiar with that distinction between, I think you used the phrase, custodial care versus, what was the other type of homemaker home health aid?
It's a certified home health aid that is supervised on a plan of care from the RN, from the hospice nurse. So they're there to do what needs to be done based on the terminal illness, the needs the patient has due to the terminal illness, but not just for custodial care. There's an expectation that family and friends step up to the plate, or private hire comes in as well.
Yeah, I think that's a tough distinction to make. I don't know the regulations as well as you or Catherine Kemp and others, but if there is a specific situation where you believe a veteran, is not getting what they need, and there may be an opportunity for VA to fill that gap, boy, please do, contact me. You can go through the We Honor Veterans website there, or I'm happy to put you in touch with someone at the local VA to try to sort out any of the challenges.
Thank you very much.
Yeah.
Once again, just a reminder to our audience, star one if you have a question or comment.
Hi, Pilar. We're actually gonna stop at questions right there. Scott, I know you need to jump off the call. I just want to thank you for joining us, and I'm not sure if you have a few minutes or.
Well, I do, Catherine, and what I tried to do is I was trying to get someone to cover for me on my subsequent call, just because it just seemed like these questions to the Survivors Assistance Program were so important. So if you want to continue, I will hang on the line until it's appropriate for me to step in. It just seems like there's an abundance of really good questions.
Definitely. I mean, if you're able to, of course, we'd love to have you stay on. I do also want to just be, cognizant of Maura Johnson's time, who is our next speaker from Storycorp. So if it's okay with everyone, maybe we can go ahead and have her present a bit on Storycorp, and then at the end we'll open it up to questions for everyone.
Scott Bell and I are happy to stand by and also listen to Maura about Storycorp. Thank you.
Oh, wonderful. Thank you.
Okay, should I jump right in, Catherine?
Yeah, thanks, Maura.
Yeah, thank you so much. And it's been great just listening. I feel like I've learned already a lot more about the Department of Veterans Affairs in the last 20 or 30 minutes. So thank you so much also for allowing me to be part of this call today. And I'm very happy to once again be working with We Honor Veterans. It's a really wonderful program, and we at Storycorps have been really honored to be kind of providing resources for this great project in hopes that there could be great collaborations and ways to better preserve the memories and lives of veterans across the country. So I'd love to just jump in today. I know we don't have a lot of time, so I want to respect everyone's time in general. I thought I would give a brief introduction to my specific department's work here at Storycorps and some general context to our organization, and then just jump straight into some tools and resources that you all would be able to use with individual families and patients that you're serving across the country. And so I thought I would jump straight back in. So Storycorps, it sounds like many people might be familiar, but for those of you who are not familiar with Storycorps as an organization, some very quick background information is that Storycorps was founded about 13 years ago, and we are a national oral history project. We record conversations around the country between loved ones, family members, and friends. And we have an archive at the Library of Congress and in their collections there, so that these stories and conversations can be preserved for generations to come. We record stories in a variety of manners, both in booths. We have booths in Chicago, Atlanta, and San Francisco. We also have a mobile booth that travels around the country recording these types of conversations between family members and loved ones. My specific department at Storycorps has been very focused on providing that same experience of recording a story and having your legacy preserved for those who are in any way affected by serious illness. So for the past, I would say, 7 years now, Storycorps has been running a program called the Legacy Project. And Legacy is all about recording the stories and experiences of families and patients who are affected by serious illness. And we have developed a lot of resources and training tools so that partners across the country, any type of healthcare provider that we work with, will then be able to go out into their communities and record these types of conversations on their own. So Storycorps Legacy has been doing this type of work for about 7 years now, and we've partnered with over 50 healthcare providers and organizations across the country, including small hospices all the way up to very large hospitals and healthcare networks. We provide trainings, resources, sometimes even equipment so that the teams on the ground can record conversations directly with patients and their family. And the real goal around this type of work is that you can incorporate the Storycorps model into your existing services and provide this as a resource for families and their loved ones. The stories are all recorded in a manner of ways, either on equipment we provide or via a downloadable app. And then the stories can then be archived with the Library of Congress as well as with Storycorps. Storycorps has a variety of ways that we use the audio. We, again, archive it, and we also have a weekly broadcast on National Public Radio. So oftentimes these longer conversations are edited down and shared on the radio, sometimes also turned into animations and shown on PBS. So the real goal is to also create more of a culture of listening around the United States and really share our shared humanity and celebrate our shared humanity through these stories. One way that all of you could get involved, and I know last fall, I think it was, Catherine and I were in conversation as well as with one of my colleagues around the idea of really using the Storycorps app to record stories in partnership with We Honor Veterans. The Storycorps app is a pretty recent tool that we're offering to partner organizations. It basically is the provides you with all the resources and ability to record stories as a free downloadable app that you can use on any smartphone. You can download the app and then record either directly with patients and families, or you can also sort of mobilize patients and families, provide them with the link that they would then download the app themselves and record stories on their own phones. What's great about the app is, well, there's several things, but it's free to use. It's really easy to use as well. Typically, it really is a great tool as well for intergenerational conversations. So if children or grandchildren want to interview an elder, it's a great resource that we've seen work really, really well, especially with school-age children who typically have a knack for using apps and can use this as a great tool to celebrate their own family's heritage and legacy. I know that, Catherine, I sent a few handouts in advance of the call, and so you'll have access to those. Either you might already have access to them or you'll have access to them after this call. One just gives an overview of the Legacy Project, but the other is very much focused on the Storycorps app in and of itself, and it just is a quick how-to guide about how to download it and access it as a tool. In conjunction with We Honor Veterans, we actually created some initial tools for all of you already last fall. The first of that being a community page on our website. So every interview that's recorded with the app, if you choose to share it, or if the participants choose to share it, it would go up to an online platform, which is called Storycorps.me, Storycorps.me, which is basically an online archive of all of our app interviews. It's accessible to the public. You can share interviews. You can share hyperlinks. You can put them on Facebook and on Twitter. So for younger generations especially, as well as for organizations that are hoping to spread the word about their community and the work and services that they provide, it can be a really wonderful way to make these stories more widely accessible across a large community. So the community page itself on our page, Storycorps.me, I will send, let's see, I think Catherine should have a link to it, but you are welcome. You can just Google search even Storycorps We Honor Veterans, and it's the first thing that pops up. Right now there's only one story recorded, but there's some great questions that have already been created by the team at We Honor Veterans. And so if you're thinking of sitting down to record these types of stories with patients or families, or to provide this as a tool that they can record stories amongst themselves, this is a really great place to send them. There's some initial interviews that they can take a listen to. They can join the community as individual users on the app, and then they can also access these questions, which many of them are really focused on the legacy of veterans in this country. So questions around where and when they served, the types of experiences they might have had in combat, the legacy they might want to leave, what lessons that they learned throughout their service. Really the type of questions that family members may be hesitant to ask right away without a really proper setting and tone through which to ask them. And so the whole point of these conversations is really to get families talking about the legacy they hope to leave and about their shared memories and experiences, and hopefully to have this recording that can then live on in the Library of Congress and on this website for years to come, and really be a resource to families and loved ones. The app, again, is free to download, and you should be able to access the community, and it looks like you can actually join the community and leave it at your will. So it's very easy to access. There isn't a moderator or anything like that on the community page. And in terms of recording stories, it's quite simple using the app. We are constantly updating it. We have just made a new update actually to the app. So it's something that I definitely will say is still a work in progress. That being said, we're constantly working on fixing it and making it even better for our partners. And what's very nice about it is you can, again, access it anywhere. You don't need a cell phone service to use it, just to upload the interview. So it's really nice to be able to access this as a tool when you're thinking about perhaps starting your own type of reminiscence program with patients or families. And we have plenty of tools and resources through our work as Legacy that we can then share with you as well, as hospices especially. So if you're interested on tips and ideas and best practices around recording with patients and families affected by memory loss or with pediatric patients, we have a lot of resources for that as well. So again, we're always happy to be in touch with all of you. We've worked with a lot of hospices throughout our 7 years, and it really is a wonderful natural fit for this type of work. And we've seen some beautiful stories be captured and recorded and preserved for families to share for generations to come. So I would encourage you all to take a look at the one-pager about the app that Catherine has distributed. Maybe take a chance and download it on your phone and kind of look through it and how it functions. And think about this as something you could even offer to patients and families that you're serving yourselves. The resources that I provided are all free to share, so if you want to make copies or pass them out to patients and families, please do. And if there are resources that you're lacking or questions you have, don't hesitate to also get in touch. We're happy to talk with you as well. So I know I wanted to also save a little bit of time for questions, and I know that we also are kind of wanting to give a bit more time to Moira as well. So I thought maybe we could take a few minutes for questions now, and feel free to also reach out after the call via email if you have further or more detailed questions.
Wow, thank you so much, Moira. Yeah, just to everyone, as she mentioned, she did send on some great resource materials that will be posted on our website along with the call notes. A really easy, how-to guide gets you started. And as she said, if you have any questions or just want some help kind of walking through the setup or installation process for downloading the app, please reach out to us. We're more than happy to help you. As Moira said, she's also, always welcome to answer questions. There is, as she mentioned, a community already up, a list of questions for you to go through, as well as a recorded story from Hospice of the Chesapeake. So if you get a chance, just go on and maybe have a listen. But again, thank you so much, Maura, for joining us. And if anyone has any questions.
Once again, as a reminder to our audience, *1 if you have a question or comment. You may hit the star key followed by the digit 2 if your question has been answered. And we'll move to Mariset Hassan with the Carolina Center for Hospice and End-of-Life Care.
Oh, hi. Thank you so much. I've really enjoyed being on the call. We are a Hospice Veteran Association convener for the state of North and South Carolina and have quarterly calls, and I'm sure a lot of our folks have been on this afternoon. I have a question about the Storycorps, if you could clarify. I know we are focused on veterans, but you made a comment that we could use it for other patients. Is it exclusively for veterans, or would it be something that could also be used for other patients and families?
Thank you so much for your question. That's a great thing to bring up. This is open to anyone to participate in. The Storycorps app and all of our recording booths around the country are public spaces that people are welcome to use. The app in particular, anyone can download and record a story using that. The only thing that's really focused on veterans is this online community page and the really specific to veteran questions that are posted there. So if you're looking to record veteran stories in particular, that's a really great page to start. But if you just want to record any patient or family story, that one pager just talking about how to download the app is a great place to start instead. And feel free to distribute that at your hospice or at your care center or to families who might be interested in this type of experience. we highly encourage families to download the app on their own phones and take it home and spend time together thinking about how they would like to record and the type of questions they'd like to ask each other. There's a large, very detailed list of just great conversation starters on the storycorps.org website under Great Questions. And so that's a great place to start as well in terms of providing resources to any patient or family.
Mm-hmm. Thank you. The second thing I'd ask you is about the mobile unit. Are they in certain regions of the country? Do you have them, where exactly are they stationed or?
Yeah, they travel actually in an old Airstream trailer around the country to dozens of cities every year. They usually are there just under a month per city. And so you can find a full schedule of where they'll be recording next on our website as well under Participate. But, for example, right now they just left Bloomington, Indiana, and are headed to Detroit, Michigan, where they'll be for a full month. Then after that they'll be in Des Moines, then Minneapolis, St. Paul, Shreveport, Louisiana, and then Corpus Christi, Texas. So,
wow.
If you're interested in working with them, please don't hesitate to get in touch. And they have public appointments where people in the community can just call in and set a time aside to record their story.
Okay. And the final comment that I would make, and this is in reference to what was just discussed right before you started, in our area, the VA hospital has an aid and attendant division, and they will work with the hospice and supplement custodial support care for patients that are on hospice, in addition to what the hospice is providing with the aid. So I don't know if that is something that's just a regional thing for our vision in this area, but our programs have been known to be able to have a collaborative, complementary approach with the supportive care services in the home, where they provide some home hours for that veteran and the hospice, but they don't do it on the same day. So that's it for me. Thank you for taking my question.
Thank you so much. Of course. Thank you for your interest.
We'll move next to Cinda Saunders with Holzer Hospice.
Yes, I don't sound like her because she had to leave, but I'm Ron Jeffrey. I'm a hospice volunteer, veteran on veteran program, and I get assigned to the veterans who come into hospice to go visit and talk to them. My question, I have a couple things here. Number one is, on the storyboard, can a story be told about the life of one of our patients that have who is now deceased? Say, when I go, they talk to me, they tell me things they probably wouldn't tell other people simply because I'm a military guy person. Also, I'm a Vietnam veteran and also a retired Air Force. Can stories be told in behalf of some of these folks that have gone on like that, that's not connected to the family? And if it can, do I have to have a written permission slip from them to do so?
That's a very great question. We do record a lot of remembrance interviews at Storycorps, so people who have been touched by someone else and their life experiences and have had long conversations with that person, but that person has now passed away, may want to come into a booth or record with the app, just sharing the memories that they had with that person. If it's something where you're mainly just telling the stories of a veteran who's passed away but with whom you've mainly just had and been in touch with as a volunteer, I think that's still perfectly appropriate, but you might want to check in with the family if you're at all in touch with them, especially if you're going to be sharing very detailed stories or things that the family might not be open to. I feel like that's on a local level, kind of on a personal level for you and your familiarity with the family and what they would be open to. If it's something that's very important to you to share, however, I definitely encourage you to look into using the app and sit down and record some of those memories. The biggest thing I would say when you're recording stories, either using your phone or telling someone else's story in that sense, is just trying to be mindful of what would or wouldn't be appropriate to share, or respecting someone's privacy if you knew they were a very private person who might not want those stories shared. That would be my only word of advice.
I've done a military eulogy at the funeral of a couple of these. I'm technology disqualified. And so therefore, using apps and stuff, I don't know if I could personally be able to do that. Is there ways in which it can be typed and sent in and be a part of that? Or I know you're doing oral histories, but I don't know about the other part of it.
Yeah, all of the recordings we do, all of the histories that we record are on audio. I definitely understand the hesitancy around using an app. Even being a very much younger generation, I still have hesitancy downloading apps and using them because it's just not something I grew up with and I'm not as familiar with them. So I do understand that. Again, it's very easy to access and download if you want to give it a shot. And if it's something that you're just hesitant about and are not sure it's the right fit, do know that there are other opportunities to record with us. The biggest one being that, again, we have this mobile tour that's traveling the country to different cities every single year. So know that that's one opportunity if they come to your city that you could actually go to a booth and have someone walk you through the entire process. We also do sometimes host recordings across the country, so keep an eye on our website and know that we're also trying our best to record in smaller communities and provide this as a service as much as possible. The legacy program in and of itself does oftentimes lead very long trainings and partnerships where we're recording for many months at a time on site at a hospice or at a hospital. But that's something that has to kind of be built up with the hospice and hospital staff and have their supports and resources behind it. So as a single volunteer, I definitely would encourage you still try to use the app. If you're working with families, for example, of veterans who you have worked with throughout the years, perhaps there's also a grandchild or a child in the family who is very app savvy and would possibly be interested in sitting down and having this conversation with you and kind of facilitating the process as well.
I think what I'm going to have to do is give them your guys' Storycorp ME app or website, because I don't have a phone that will work that way, and I don't even have email. So,
Okay.
But you give me a resource now that I can tell them, and I usually talk to them and say, you need to record some of this stuff about what he's telling, he's telling me. But I now have a resource. Thank you. You've been very helpful to me.
And if you're ever interested in just sitting down and recording, and I understand not having a smartphone, and I definitely think that many people do not, and that's a hindrance for sure to access this program. So if you don't have a smartphone and can't actually download the app, even if you can get your hands on a cheap audio recorder, I highly encourage you to sit down, look through some of the questions, and record on your own with family members and friends.
That's an idea. I think I've done it for myself, so I'll have to do it with them. Thank you.
Thank you.
All right, thanks everyone. We just have a few minutes left, so just want to open up maybe one or two more questions for Moira, Scott, Maura, or the other Scotts if you are still with us. Just a couple more minutes to go.
And we'll move next to Veronica Palomino with Vitas Healthcare.
Good afternoon. Can you hear me? Hello?
Yes.
Can you hear me?
Sure can.
Oh, good. Okay. Hi. I am Vitas Healthcare Veterans Community Liaison, and I have lots of questions, but I have one in particular that maybe someone could possibly answer. One of our hospice patients just passed in April, a veteran, and the spouse applied for the appointment of veteran status, or the VA Form 2122, and the VA Form 21530, which is an application for burial benefits. The Department of Veterans Affairs from Philadelphia came back with this decision saying that the surviving spouse was not eligible for any type of veteran benefits because of whatever the cause of death, and then because of the income. Is there someone that I can contact as a follow-through, maybe to look into this particular case further? Scott?
This is Scott from the Office of Survivors Assistance. Yes, please feel free to contact us. You can give us a call or shoot us an email, whichever is more convenient, and we'll be happy to go into this a little bit further, and we can go into greater depth about the benefit. And, you know, I'm the first to admit sometimes we get it wrong, so maybe there's something we could do to fix it.
Okay, so I can actually forward you the email with the DD-214 and the application and the denial letter, and then you can look into it? Okay, and I have your email, correct? Or
Yes, at Office of Survivors@va.gov.
Oh, okay, thank you. I'll send that over to you. Thank you.
And we'll move next to Tony LeBaron with Great Lakes Caring.
Hi, I more or less just wanted to comment. I'm new to the We Honor Vets program here at Great Lakes Caring. I've only been with the company for about 11 months, and I just recently got put at the forefront of the program. I'm an Iraq and Afghanistan veteran. I was wounded in Iraq in 2009, and so I'm 90% through the VA, and so I know the VA system pretty well. And so I think that gives me a little bit of an advantage dealing with the issues that veterans face. And so I've become an advocate for making sure that all the veterans here on our hospice care are getting the best care that they can. And that veteran program is fantastic, and I thank that gentleman who is a volunteer for doing that, because, you know, he's right. Veterans are way more likely to speak freely to other veterans about their experiences than they are just the average civilian. But more or less, I just wanted to say thank you for all this fantastic information that we've gotten today, and I'm going to be picking apart everything that you send us after the call is over, and I'm probably going to be following up with a bunch of questions. So thank you again for everything you guys did today.
And thanks for what you did. Thank you.
Next we have Jane Metz with Hospice of Siouxland.
Hi. First of all, thank you for your service, sir, the gentleman that just talked. And second of all, we do an oral history project. Maura Johnson, I think, is who was talking about the Storycorps. And you were talking about downloading in apps and different things. How do you record the stories? And is it by a smartphone? Is that what you use? Because we use digital recorders for those and those kinds of things. And also, as we've come to doing level 4 with our We Honor Veterans, we when we go out and pin the veteran, then we take a picture of them, and then we also ask them for a little story. Not a huge story, but, you know, just like a little, like the gentleman yesterday that I did said he made the best ice cream on the ship, and that was his thing. And, you know, so we just kind of put that with, we actually put it on Facebook, and then our people are forwarding that to the Veterans Association, and I've had some really, really cool stories with those. One gentleman helped with the airlift in Berlin, and just really neat stories. But I'm just wondering about the app part you were talking about.
Yeah, great question, and I'm so glad to hear that you're already doing oral history work where you work right now. I think it's so important to have these stories recorded and preserved for future generations. So I'm always excited when I hear this happening across the United States. One option in terms of recording with Storycorps is via our app. So it is something you would download on a smartphone, and you can actually record directly with the mic in your smartphone. If you already have digital recorders, that's actually even better in a lot of ways. And there actually is a way to, if you want to participate in the We Honor Veterans project, where these stories are being kind of uploaded to a website and shared in one common platform, there is a way to upload the audio just via a desktop computer that you've already recorded on a digital recorder. So if you still want to participate, I can definitely send follow-up instructions for how to do that.
That would
you would
be
just
awesome.
create an account on the website, and then there's a way to add an interview, and you just upload the audio file that way instead of using an app.
most of the time when I take their picture, I just, kind of write down their little story. I don't actually record it. I just write those down, so it's not recorded. Would that make a difference?
Typically, there should be some type of audio recording as well.
Yeah.
So if you have an audio recorder on hand,
we do. That's gonna. That's why I was wondering how I'm the gentleman a couple times ago was talking about how he's not Apple smart or whatever.
Mm-hmm.
That would be me too. So
I completely understand.
I'm sorry.
Where both are coming from. That is okay. And the website again, I can provide some resources.
Storycorps.com.me.
So the website where all of these are posted is storycorps.me. So that's STORYCORPS.me.
And then is there a /We Honor Veterans or no?
I think it's like a /communities/We Honor Veterans. And the other quick way to do it would just be a Google search of We Honor Veterans and Storycorps, and that will bring it up as the first hit. Again, if you're looking to participate in one way or another but don't feel like audio recording is a great fit for you, or just feel like perhaps some of the technological side of this is too much at this point, one thing to do would just be if you can access that website and see some of the other interviews that are coming up and also read through those questions. I encourage you just to take those questions, print them out on a sheet of paper, and sit down and have the conversation. There's so many ways to, help veterans, families, patients through just the simple act of being a listening ear. So I think that if you want to just take these as resources and just, have more of a conversation with folks, that's also a really great way to start.
Yeah, that's great. Thanks so much for sharing all this, because I actually had a veteran that did his oral history on, and he was a volunteer of ours that did his oral history and then ended up making copies for his family for Christmas.
Oh, wow.
And his whole oral history was on his service, and his family had no idea that he had done all that, so it was really cool.
Yeah. It is quite amazing the power of a human voice when you think about remembering a loved one. Just hearing their life and their own experiences and their voice can be very, very touching and meaningful for families.
That's why we like to do the digital, because that way we can download it onto a CD, so then the family has their voice plus the story.
Yeah.
So thank you so much for talking to me. I appreciate it.
Yeah, thank you for your work.
Next, we'll move to Charlie Schulte with Appalachian Hospice Care.
Good afternoon, and thank you for all the really helpful information today. While I was listening, I went to peruse Storycorps.me, and it says you must be a member of We Honor Veterans community to view this content. And unfortunately, I've inherited this arm of community development from someone that's left, and I don't know what our sign-in stuff is. And however, I got the email about this call. I didn't get any precursor information. You guys were talking about a page concerning Storycorps. I just wanted to make sure that I would get the follow-up information and perhaps some help on how to find out what my sign-in stuff is for We Honor Veterans.
Sure. You actually can create that on your own independently. Okay. So you just create on that website that you have up. There should be a button near the top that says Sign Up. And you can actually create your own username and password that way.
Okay.
And then when you go back to that Storycorps We Honor Veterans page, you can just click a button that says Join Community. It's open access. Anyone is welcome to join. So there's no special...
I don't have to have the We Honor Veterans sign-up stuff.
Nope, there's no extra sign-up. Anyone is welcome to join.
I'm so excited to get started with this. I have some really interesting that I've talked to that I've wished I had recorded before, so this is delightfulness. Thank you for your time.
Thank you
And
for
that's
your
all I
interest.
needed.
Perfect. I look forward to seeing the stories up.
Thanks.
Well, thank you all. I think we've actually gone a little bit over, but lots of great questions. And if you have anything else, even if you think of something later that you didn't get a chance to ask, feel free to reach out to us, veterans with an S at nhpco.org, and we'll be happy to answer you as best we can or put you in touch with whoever might be able to help you further. So if you have any other questions that come up for Moira or Scott or more from Storycorps or, our buddy Scott Shreve as well, feel free to send them on and we'll be sure to put them in touch. Just a quick update. We wanted to let everyone know that the long-awaited LNEC for Veterans curriculum is up on our website. So LNEC is the End of Life Nursing Education Consortium. So this is actually something that was done about 6 years ago, and it's just recently gone through a very thorough update. So the entire curriculum is now up, and it's free on the We Honor Veterans website. There's actually 7 modules of content, everything from pain management to cultural considerations. They're all up on the website. Slides, faculty guides, references, case studies, anything you could need is up there. So we're very excited about that. Again, thank you all for joining us. Wishing everyone a very safe and happy 4th of July weekend. We hope you'll be joining us for our next call. And again, please feel free to reach out if you have any questions or feedback from us. We always like to hear that. So, all right, take care. And thank you again to our speakers for joining us. We really appreciate your time and that you were able to join us.
And thank you, Catherine. We enjoyed it as well. And goodbye, and thank you to everyone for everything you do.
Thank you, everyone.
Thank you so much. It's been lovely.
Thank you.
And everyone, that does conclude our conference call for today. Thank you all for your participation. You may now disconnect your line.